So assuming that this is your baby and this your baby is having fever, very high fever, and at the same time now develops convulsion while you are at home. So you are the father or the mother or the caregiver while the baby is having convulsion. The question now is, what are the things you are supposed to do in order to prevent this convulsion from progressing and prevent other complications, or the things you are not supposed to do for this baby? Because I have seen a situation whereby by the time they are bringing a patient that is having convulsion to the hospital, that person has already developed complications, not from the convulsion itself, but from the treatment they have given at home. I want to understand something. What will kill this patient that is having convulsion is not likely from the convulsion, but usually from the kind of treatment people give at home. Understand also that somebody that is having convulsion is not meant to be treated at home. You are supposed to take that patient to the nearest hospital where a trained medical personnel will attend to that person as early as possible in order to prevent further damage that may arise from that convulsion. Please help me to share the video so that we'll be able to get to many people as much as possible. And also, if you have not joined our community, kindly join by subscribing and following us in our different platforms. Also, like this video so that other people will be able to see this very video. Thank you so much. So what are the things you are not supposed to do for this person that is having convulsion? I want you to understand something. Whenever somebody is having convulsion, at that point the person is having that convulsion, they are not usually aware of the environment. They are usually unconscious. So if you put anything into the mouth, as I see this mouth is open, if you put anything into the mouth of that individual, something like water, something like oil, or anything at all into the mouth, that can enter into the lungs of that individual. This will kill this patient faster than the convulsion that individual is having. So it is not necessary to add anything into the mouth, be it oil, be it water, be it food. Don't rub oil on the face, don't rub oil into the eyes, don't pour oil into the nostrils. Don't put anything at all on the face. Just ensure that the environment where the person is safe. If there is something like fire, remove the fire. If there is anything like sharp that can cause harm to the person, remove it. Don't even try to restrain the person by pressing the person down. Just ensure that the environment is safe. This is one of the things you're supposed to do. Then, don't put something like metal, maybe something like spoon. I will see some occasion whereby some mothers will try to put spoon into the mouth of a child that is having convulsion. Please, it's not necessary. Allow that baby to have convulsion by the side, the way I am going to show you further in this very video. While you are trying to call somebody that will help you to take care of the baby, maybe a doctor or a nurse, or while you are trying to move the patient to a nearby hospital, please don't do anything that may further compromise the health of this patient. Do you understand? So the question now is, what are the things you are supposed to do at the time you are making an arrangement to move this baby to the nearest hospital, or at the time you are calling a doctor or a nurse to come and help you in the care of this baby? What are the things you are supposed to be doing in order to prevent further complications? Understand something. Remember that initially that this baby was having very high fever, so the body was very hot. So one of the first things you are supposed to do, even before the convulsion will start, is to expose the body of this baby. Remove the cloth of this baby whenever you notice a very high temperature, very high fever. Remove the cloth so that the body can cool off. This can even prevent the convulsion from occurring. But whereby the convulsion has occurred, or even before the convulsion will start, it is also important, as you expose this body, to do what is called tepid-sponging. You will use a lukewarm water, that is a water that is not hot, water that is not cold. So not hot, not cold water. Rub all over the body so that this will help to reduce the temperature of this baby. This can even prevent the convulsion, or at the time the baby is having that convulsion, if you do it, it can also help to stop it at that point in time. While you are doing all this, you remember to put this baby, place this baby on the lateral position. This position you are seeing, lay the baby on the side like this, not on the back, but on the side. If you lay the baby on the side, if there is anything in the mouth, it can fall off. Do you understand? Because when you lay the baby on the back, or the individual on the back like this, the tendency of the tongue of this individual falling and closing up the upper airway and preventing this patient from breathing is very high. So you lie the patient on the side. That will allow the patient to breathe fine, and at the same time recover very well and prevent further complications, so that the patient can be breathing very well. If you find this video interesting, please help me to share it to many people, so that people will be able to understand what I have just taught in this very video. Thank you so much.